Today we will going to see tuberculosis. In short, we also called as a TB, isn't it? We all know TB, okay? Tuberculosis. Actually, this is a infectious disease, okay? This is an infectious disease caused by Mycobacterium tuberculosis. But usually we call it as this is a respiratory disease because the lungs are affected more. But if the TB persists for more time, if it is chronic years together, then this may be caused to other organs also, that is the intestine, brain, bones, isn't it? All over the body. Okay, so this is usually come under the infectious disease. Before it was coming in the respiratory disease. Okay, so we will see tuberculosis. Introduction, see the introduction. It is a chronic infectious disease caused by tubercle bacilli. Tubercle bacilli, or we also call it as a Mycobacterium tuberculi bacilli. Mycobacterium tuberculi bacilli. Okay, or we can also call as a tubercle bacilli. Okay, whatever it may be, which primarily affects the lungs. Actually, it affects the lung primary. Okay, first the organ it affects by this tubercle bacilli, that is the lungs. Lungs means where it comes under the respiratory system. So actually primary tuberculosis, that is the TB, it is a respiratory disease. Okay, let it be. And causes the pulmonary tuberculosis. Primarily it affects the lungs and causes the pulmonary tuberculosis. Causes the pulmonary tuberculosis. It can also affect intestine, meninges of the brain, bones, joints, lymph glands, and other tissues and organs of the body. Okay, that is the secondary one. It can occur at any age, no limitation. It occur at any age, but more commonly it affects to the older people. Okay, more commonly it affects to the older people. Okay, it is more common in males than the females. More common in males than the females. Why? Can you tell? Because this is a pulmonary, it affects the lungs. Okay, because the males are having habitual of cigarette smoking, isn't it, than the females, isn't it? So more primarily this more commonly seen in the males because the lungs are affected due to that smoking, isn't it? So it is mentioned here that more common in the males than the females. Males are more smokers than the females. In India, usually females are not smokers, isn't it? So now we will see the classification. Okay, primary classification and secondary classification. Primarily means it comes to the this one we will see in detail here. TB, it is classified on the basis of appearance as well as clinical manifestation. Clinical manifestation, that is the signs and symptoms after exposure and location of the bacilli. Okay. See here the primary infection. It occurs first exposure to tubercle bacilli and enter in the terminals of the alveoli of the lungs. Means what? Primarily it is exposed that when the bacilli enters into our body, primarily it gets located, it's enter into the lungs, but where? Directly at the terminals of the lungs, that is the alveoli of the lungs, directly in the alveoli of the lungs. It is more often reported in children and in immune compromised patients. Means what? Already it is more common, it is reported in the children, and that also suspected to the immunity, low immunity power. Okay, the children, those are having low immunity, usually affected by this tubercle bacilli. Okay, now secondary, next classification, next type, that is the secondary type tuberculosis. It is usually due to reactivation of the dormant lesions, reactivation of the dormant lesions, or a reinfection of the person who already hypersensitive due to the earlier exposure. Means second time the infection, if it affects to that person, that individual, then it leads to causes the secondary signs and symptoms that we called as a secondary TB. Okay, secondary tuberculosis. It is usually due to, here you have to keep in your mind, that is the reinfection or reactivation of the dormant lesions. Sometimes what happens, these bacilli remain dormant. They are not showing any signs and symptoms. They are remain like that only for years together, for 6 months, 1 year, 2 years, 3 years, isn't it? But when they will activate, again shows the signs and symptoms, isn't it? That is, here it is mentioned that due to reactivation of the dormant lesions or reinfection of the person. Again, if it will affect to that of the bacilli to that individual, that is the reinfection. Are you understood this one? Both the terminologies, reactivation, that is reactivation is different and reinfection is different. Reactivation is the bacilli in the dormant phase, they are present in that individual only. When they will reactivate, that time the TB will appear. Okay, the signs and symptoms will appear. And the actually here in the reinfection, what happens in the reinfection? The infection is caused second time to that individual, but the dormant phase bacilli are not present in that individual's body. Okay, this is the main differentiation. Okay, who already hypersensitive, who are sensitive, that only immune susceptibility, isn't it, due to an earlier exposure. Based on the anatomical involvement, now see here, anatomical involvement. Again, it is classified into pulmonary TB and extrapulmonary TB. Okay, how many types now we are seeing here? Primary and secondary. Are you understood this one? Primary and secondary. Primary means first exposure, and secondary means second time exposure, or otherwise reactivation of the dormant lesions. Okay, now next, that is the anatomical second classification, that is based on the anatomical involvement. Anatomical involvement according to the organs or according to the structures. Means pulmonary TB and extrapulmonary TB. Pulmonary TB means the name itself indicates here. It is most common type that indicates the involvement of the lungs, especially pulmonary parenchyma. Okay, pulmonary TB, it affects to the lungs, and extrapulmonary TB means what? Extrapulmonary TB means what? It indicates the involvement of the organs other than the lungs, which includes lymph nodes, intestine, bones, genitourinary tract, isn't it? So other body organs, bones, joints, okay, lymph nodes, okay, genitourinary tract, okay, joints. The pulmonary involvement may or may not be reported. Here, extrapulmonary TB, the lungs may get affected or may not be. That's why the name is extrapulmonary. Pulmonary, extrapulmonary. Understood this one? Now see here the causative organism. Which is the causative organism? Mycobacterium tuberculosis or Mycobacterium tuberculi, an acid-fast bacilli. This is the acid-fast bacilli. Other types of the tubercle bacilli are also responsible for the tuberculosis, but this is the main we can observe when we test under laboratory. We found mostly the Mycobacterium tuberculi bacilli only, but other bacilli are also there, that is we called as a tubercle bacilli. That's why I mentioned here before that one tubercle bacilli. The 4 tubercle bacilli are there. Main that is the Mycobacterium tuberculi. Okay, tuberculi. And the others are also responsible for causing the tuberculosis. These are Mycobacterium africanum, Mycobacterium africanum, and second one Mycobacterium bovis, Mycobacterium bovis. Okay, these are also available that are also causes the tuberculosis. The latter two species are specified as, these two species are classified as non-tuberculous mycobacteria, non-tuberculous mycobacteria, and non-tuberculous mycobacteria can cause neither TB nor leprosy. Okay, neither TB nor leprosy, but they do cause pulmonary disease that resembles to tuberculosis. Are you getting? So nowadays the objective the MCQs are there, isn't it? Objective wise question paper are there, MCQ question types are there. So if they will ask you what is the responsible bacilli, you just write there the Mycobacterium tuberculosis or tuberculi. Okay, because these two species, Africanum and bovis, Mycobacterium africanum and bovis, these two species are non-tuberculous mycobacteria. Means what? They neither cause TB or nor cause leprosy. Okay, but the disease produced by these mycobacterium, these bacilli are, these are resemble, these are looks like or similar to that of the TB, that of the tuberculosis. So these are also come under this one. Okay, understood? Now see here, mode of transmission. Mode of transmission. How the transmission takes place, you see here. Tuberculosis is mainly transmitted by droplet infection. Means what? Sneezing, coughing, isn't it? The single drops. Okay, that's why we always say that you use handkerchief while sneezing, while coughing. Because if the person is infectious, that time what happens? That droplet consists of these mycobacterium, these bacilli, and that if we others they will inhale, that causes the infection. That is, the tuberculosis is mainly transmitted by droplet infection and droplet nuclei produced by the sputum of the positive patient. Sputum of the positive patient with pulmonary tuberculosis. If the person is having pulmonary tuberculosis mainly pulmonary tuberculosis, then only if the disease is transmitted by droplet nuclei. Okay, so that's why we always say that use handkerchiefs or do not spit anywhere. Okay, so coughing is responsible for the discharge of the large number of the droplets by direct contact with the patient. Direct contact, okay, by handling the sputum and other discharge of the infected patients. If we are handling the sputum or any discharge of that infected person, infected individual, infected patient, by handling the articles of the food, drinks contaminated with the tubercle bacilli. Okay, files also transmit the diseases by contaminating the food and drink of the healthy person. That is the house flies. Okay, house flies. Spelling that is wrong. Flies, that is the house fly, isn't it? This is all about the files. Okay, now see here.